had so much to talk about. So that was really, really fantastic. So we are now into our report out section of the meeting, so we can hear what some of the different groups were talking about in their area. So the first one, the first group that we'll hear from is Dominic and Dr. Cook-Bailey. I'm not sure which one of you wants to do the report out, but maybe just spending up to around 5 minutes to share what your group discussed.
I can start, Dr. Bailey, and then please, we can kind of tag team.
I like
But to your point, it was a great discussion, and we were getting right into some very meaty and neat discussions around how do you reach out to communities, especially organizations that you haven't navigated or worked with for, and then how do you provide value to those participants that are involved in those studies. And there was a lot of great recommendations from Ms. Kennedy and trying to think, I forget who else added on there, but just the approach and being very intentional about engaging in a way that you're doing research with the community and not on the community, I think was the term that was used. Mm-hmm. And then having those long-term partnerships and making sure that even you're not just coming to the organization when you have a grant, when you have a proposal already prepared, but you're sharing value with that organization. And it may not be your department, but maybe it's somewhere within your larger institution that you're connecting people and resources to support the work that they're doing. We also talked about, the importance of, how do we navigate and how do you reach out to community health centers in particular, around what that research looks like in different areas that you're focusing on research that historically maybe wouldn't have been a focus of a community health center. So we talked about yoga and meditation and some of those things where some of the populations that we serve, I think we're hesitant because we say, well, they may not be receptive to that, but we can't be the barrier, right? Especially when it's things that have been proven to help and support patients and also the staff that are serving our patients. So those are just two areas that we touched on. Dr. Bailey, I know there's a couple of more, but do you want to add to that?
I think, what I'm really taking away from, and as you said, Dominic, like that conversation was just about to just really take off and then we had to leave. But that's how it goes. I think something that resonated with me throughout the whole conversation was, there has to be this upfront investment by like whatever the, research entity is, whether it's Case Western, we had Oregon Health Sciences, we had Pitt, we had Cleveland Clinic, the folks speak out. And I'm thinking like, as someone with very little experience in this area, the way that I was able to get involved is using startup funds and connecting with the Prevention Research Center for Healthy Neighborhoods here. And that I'm in the Cleveland Institute for Computational Biology. And then I was able to use those funds to support connecting with a community resource center. But I'm trying to think, how do we make this a priority so that, someone who doesn't necessarily have startup funds or someone who wants to do good work and engage with communities and be able to ask those communities, what is it that you need? How do we kind of flip this around and make it to where there's space for that and not just, if we don't want to only focus on what we're taking away from the community, we do have to still fund ourselves, right? We do have to still fund the staff and the PIs and everyone that are going into figure out what can be done, but somebody has to pay their salary, right? So I'm thinking that's where my questions kind of came up with all this. And obviously we're in a CTSC sponsored meeting, or a meeting, but I think that's something that could use more conversation and more energy, in my opinion.
Great. Well, thank you, Dominic and Dr. Cook-Bailey, for your report out, and feel free if others want to add anything who are part of that group to feel free to chat in. If I see one person already did that, so fantastic, and feel free to just chat in if there was anything they left out that you want to share with the group. And I will move to our second group, which was I believe Golnar and Braveheart. I don't know if one of you would want to, or both of you would want to share out from your group.
Sure. Thank you. And we can tag team if that's okay. So I can cover the main points that, so we had a really vibrant and meaningful discussion. And some of the main points that we talked about different strategies and how do we refer folks from the hospital systems to the center itself for specific care, and that the center really prides itself in doing warm handoffs. And so just rather than giving cold resources, we actually help people connect with right people. That's something of pride for the center itself, and they do a fantastic job. Then we were also talking about the vast amount of services that the LGBT Center actually provides to scaffold the system, right? And to support people who are ignored by the larger systems. And then we largely talked about what are the responsibilities of the community itself. So the research community, and how do we then support the center in doing what it really does very well. So what are the expectations from researchers, right? Like you're supposed to not only disseminate for researchers, but for the community itself, and make it something actionable and implementable for the center, for the folks. It is our role as researchers to close the loop and provide the center and Golnar with like very specific tools and responses based upon our research. Finally, she came up with some really good points for us to show up. And part of it is for us to show up not only during Pride Month, but the entire year, for us to have actual skin in the game, and to move beyond what is the rainbow capitalism and actually wholeheartedly engage with participatory-based research. Golnar, what did I miss?
No, that was great. I don't feel like I particularly have a lot to add. I feel like I did a lot of talking, so I would love, like, if anybody else from the group would like to share what they, what their takeaway was.
Great. And I know sometimes in a large group, unmuting and responding can be challenging. So again, feel free to, and I see some of the chats, around sort of the importance of trust and authenticity, and also how can we introduce this concept of how academic health centers can contribute to community engaged research in different ways. So, and then also some concern about, trying to avoid introducing harm into some of those relationships. Great. Well, thank you both so much for that report out. And again, if anyone has anything to add from that group, just continue to do that in the chat. And then I think for our third group, we have Shari. I think, well, since I was in that group, I know that Tyler was going to start the report out, and then Sharita could add anything, or anyone else in the group could add something.
Sure. Well, it was great to be a part of a lively discussion with Sharita and Dr. Bolen, and as well as some others from UH and the clinic, as well as the VA, and I'm sure others that I may be forgetting, or we didn't get to hear from their organization, but definitely some great, some collaborative discussion with some themes across. The big one is just concerning trust and kind of a reluctance to participate in research or maybe access healthcare traditionally through the major kind of institutions. So some of these sort of issues, particularly in some of the trust, particularly related in the Black and African American communities. So it's sort of, what is the role of a CDC such as Burton Belcar? And something that we can very well see is that they're very good at being a convener, and it's in their wheelhouse to regularly engage the community to help with and sort of having those trustworthy relationships with the community. And so what we heard from a lot of in the group was institutions as maybe silos, if I may say, are often trying to figure out how to do this. So it was kind of nice that we were all brought together knowing that Burton Belcar, this is something that they do regularly, is engaging the community, sometimes for the sake of collecting data, but oftentimes it seems like for the sake of listening and validating their story and addressing their needs in a meaningful way. And so as it relates to data collection, like through something like the community health needs assessment or otherwise, what do we do with that data once it's there is a big question for institutions and also for the CDCs, it seems. So how might we cross-reference findings to align the results and establish implementation plans that work for not only the institutions, but also the communities that are being served. So, people want to know that their stories matter, and they want to know that you're not only listening, but what are you going to do with the information? And so kind of like Braveheart said, actually, in that other breakout room, it sounds like, making the results meaningful for everyone involved, everybody who's collecting the data, but everybody who's also wanting something to happen with it. So really, what action items can come out of it, not just we're collecting the data, period. So that was really cool. And we all kind of seemed on board with that and sort of inspired maybe to have a meeting, together with the people that were on that call and have this conversation going, sort of utilizing the convening of the CTSC and other tools that may exist. And then I do want to add, it was the last topic that came up and we were cut off and brought into another world. But I do want to add that it did come up that despite the fact that it's a growing population, that the AAPI community has often been ignored in some of these conversations. So that should definitely be something that we consider and keep in the conversation. So Sharita, anything that or what might you add?
Oh, you did a great summary. I would just encourage collaboration, and there's a lot of work being done, a lot of research. So how can we work together, join together to make a larger impact in our neighborhoods? So that's the only thing I would add.
Great. Thank you, Tyler and Sharita. And again, if anyone else from that group has anything more that was missed that they want to share in the chat, I know there has been some responses just in general, which is great. And you can, feel free to continue to do that. What I'm hearing across the groups actually is there were several themes that were actually similar, even though I know we broke out and had some slightly different topic areas, a lot around the trust and partnering with community organizations who have built trust. There was some discussions about how to collaborate, so we're all not asking the same thing multiple times of community and building that relationship over time, not just in and out, as well as this idea of what's actionable, like what did we hear from the community and how are we going to respond to it and not just listen, but how do we respond and be actionable in the work? And then really thinking about those upfront investments and connections, as well as dissemination to community. So I'm sure I missed a couple there, but I think I did hear some themes that seem to cut across all of those. So thank you all for your participation. We are about to do our break for engagement. But before I do it, I will mention that we do have this as for 4 hours of crack, and that we will have you complete the survey afterward. We'll mention that at the end. That will confirm your attendance and allow you to get the crack participation. And I also wanted to, and thank you, yes, build the research budget to pay residents, really important chat comment. So that came up multiple times too, like paying community, both either organizations or community and community members themselves. So really important comment. And then again, we will be having our afternoon series after the break too, but not everybody can be here both for the morning and the afternoon. So just in making sure you take the post-event survey so we can do more in the future. We know what went well and what needed to improve. And then the other thing I'll just mention is we will have a community and stakeholder engagement module of the CTSC starting in July, which I and Darcy Friedman will be co-leading. And so I'm really excited about all of these comments because we can create and think about ways to incorporate all of these comments. I know we're scribing in all the breakouts, so we really have a lot of information, and we are saving the chat. So definitely put in all your thoughts and general comments. We will be trying to make sure we connect around this across our partners and looking at responses here today that we can use for that, as well as obviously the health equity series and other health equity work that's led by Jaleese Thomas. So with that, yes, we will, the survey link in the chat, I think we are going to try and do that. So maybe Jaleese or Shannon. Yes, fantastic. And then I will jump over to Jaleese. Again, thank you everybody who joined us today so far. And I will let Jaleese introduce our engaged break work that we're going to do together, and then we'll come back. But we encourage everyone to grab a lunch, or if you're hopefully staying with us, if you can, grab some food.